The significant increase in ADHD stimulant prescriptions among adults in the United States, particularly in middle-aged and older women, raises serious concerns about overdiagnosis, potential dependence, and long-term health consequences. While many argue that the rise in prescriptions reflects long overdue recognition of ADHD in women, others warn that it may be driven by over-medicalization, societal pressures, and the pharmaceutical industry's influence. The ease of access to ADHD medications through telemedicine, especially following the COVID-19 pandemic, has undoubtedly played a role in this surge. But the broader implications of this trend remain uncertain and potentially alarming. A study published in JAMA Psychiatry by the National Institute on Drug Abuse, NIDA, found that by the end of 2022, 1.7 million women aged 35 to 64 were receiving prescriptions for stimulant medications like Adderall and Ritalin, up from 1.2 million in 2019. This sharp increase has occurred alongside a broader rise in adult ADHD diagnoses, leading experts to question whether all these prescriptions are justified or if some are the result of overdiagnosis and aggressive marketing by pharmaceutical companies. While ADHD in women has historically been underdiagnosed, the current wave of prescriptions raises concerns that a growing number of people may be receiving medication unnecessarily, exposing them to risks such as cardiovascular issues, anxiety, insomnia, and potential dependence. One of the most troubling aspects of this increase is the lack of a clear explanation. Wilson Compton, deputy director of NIDA and co-author of the study, admitted that the surge in stimulant prescriptions for older women is very large, and I can't fully explain it. Some researchers speculate that undiagnosed ADHD in women may be playing a role, as females often exhibit symptoms differently than males and may not have been identified as children. However, this theory does not fully account for the sheer scale of the increase. The reality is that ADHD medications have become more accessible than ever, and the normalization of stimulant use in adults could be contributing to unnecessary prescriptions. Even though data suggests that middle-aged and older women have lower rates of stimulant misuse compared to other groups, the study still found that nearly 14% of women in this age range reported using their medication inappropriately at some point, whether by taking higher doses than prescribed, using it at different times than instructed, or obtaining it from another source. More concerningly, roughly 1/4 of all adults prescribed ADHD medication admitted to misusing it in some form, and 9% were diagnosed with a stimulant use disorder. The potential for addiction cannot be ignored, particularly given that stimulants like Adderall and desoxyn, methamphetamine, are associated with higher rates of misuse compared to milder options like Ritalin. Another factor that may be contributing to the rise in ADHD diagnoses among older women is the increasing pressures of modern life. Some experts argue that many adults who now seek ADHD medication may not have a neurological disorder at all, but are instead struggling with the overwhelming demands of work, family, and social expectations. The role of hormonal changes has also been cited, as declining estrogen levels during menopause can impact dopamine regulation, potentially exacerbating attention and motivation difficulties. While these factors may contribute to cognitive struggles, treating them with powerful stimulants rather than addressing underlying stressors, lifestyle factors, or alternative therapies could be a risky approach. The issue is further complicated by the fact that many women report dramatic improvements in their daily functioning once they start taking ADHD medication. For those who truly have the disorder, stimulant treatment can be life-changing, allowing them to focus, complete tasks, and manage responsibilities more effectively. However, the sense of finally feeling normal after starting medication does not necessarily mean that all these women had ADHD to begin with. It may instead reflect the stimulating and performance-enhancing effects of these drugs, which can benefit anyone regardless of diagnosis. This raises ethical concerns about the growing medicalization of everyday cognitive challenges and the potential for long-term dependence on prescription stimulants. Ultimately, the sharp rise in ADHD stimulant prescriptions among older women signals a need for greater scrutiny. While increased awareness and diagnosis of ADHD in women is a positive step, it is crucial to ensure that these medications are being prescribed responsibly and that patients fully understand the risks involved. The potential for overdiagnosis, unnecessary medication use, and long-term stimulant dependence cannot be ignored, especially in a society where pharmaceutical solutions are often prioritized over non-medical interventions. If this trend continues unchecked, the consequences could be significant, both for individual health and for broader public health concerns regarding stimulant overuse and addiction.